back to my channel again. Really quick video on how you look at the x-ray and inside a patient mouth and what would you recommend a patient to do. In this case, this is the x-ray that I have several x-ray that in the past, but this is just an x-ray of tube number 14 and 16. The tube really loose, and sometimes patients still want to keep it, and this is how you show the video, convincing your patient once you remove it, you're going to see very dirty tube underneath the root on tube number 16 right there, with a bone loss and the root hanging around. And the other tube is tube number 18 that you can see the meso infection tube, and really clinically there's a lot of pus coming out. Patient think it's still strong, healthy, but let me show you how the tube look like after the tube removing. Yeah, here's the tube removing of the bridge that once I cut out, and you can see that it's pretty bad looking here. Bridge cut out, and look how dirty underneath that. Patient cannot maintain it daily, and imagine how is this going to affect her systemic body. Diabetes, heart disease, all kind of stuff can be related to bacterial infection. And the same thing on number 16. Once we remove it, you can see how dirty it is. And this is how you convince the patient with video like this. Show them that even though it doesn't hurt, doesn't mean that she's okay. Really bad infection. Okay, you show the patient, show them this video. Thank you again for watching and follow up with my video. Have a great day, everyone. Take care. Bye bye.